Hello, Dr. Sutter Caton, physical therapist here. Today I'm going to talk to you about ankle sprains. So there's usually about 3 different types of ankle sprains that we categorize. The main one I'm going to talk to you today is the lateral ankle sprain because that's by far the most common. But just so you're aware, you can also have a medial ankle sprain and also what they call a high ankle sprain. So this injury is one of the most common that occurs in the athletic population. It's thought that anywhere between 10 to 30% of people who engage in any type of sport will suffer this injury. The most common athlete to suffer this, however, is basketball players. It's thought that about 70% of basketball players have had a lateral ankle sprain at some point in their life. But as you might have found out yourself or someone you know, it can be as simple as stepping down from the curb wrong or walking on uneven surfaces such as a trail that can cause you to roll your ankle and suffer this injury. So the mechanism for a lateral ankle sprain is fairly straightforward, and it's kind of one we've all experienced at some point in our life, usually what we refer to it as rolling the ankle. So how it looks is that foot and that ankle invert or sort of turn in, and we roll over the side of our ankle there, and that leads to stretching and tearing of the ligaments on the lateral side there. The most commonly torn or injured, and the first one to go even in cases where you tear multiple, is what we call the anterior talofibular ligament. So there's quite a few risk factors we look at as far as what can predispose someone to suffer this injury. The first one is having a higher body weight. It just makes sense. If there's more load on those tissues, it's more possibility that they're going to be injured. Another thing we're going to look at is poor eccentric control of the muscles involved with everting the foot. So they're going to counter the inversion that ankle rolls into in an attempt to keep the ankle stabilized. So if they're not functioning properly, it's going to make it much more easier for that ankle to roll over. We're also going to look at muscle strength of the lower leg as a whole. And a big one is, it makes sense, having a prior history of ankle sprains is going to lead you to have future ones. So as you have repeated ankle sprains, those ligaments lose more and more strength. We also notice that the patient has a lack of proprioception in the joint, so they have difficulty telling where that joint is in space. And also they have impaired muscle control and delayed reaction in the muscles involved in stabilizing the ankle. So for diagnosis of this injury, from my point of view, what I like to look at is a nice subjective history from the patient, including what they were doing when the injury occurred and what symptoms they have. I'm going to look for things like pain when bearing weight on the foot. They may have heard an audible pop when the injury occurred in severe cases. I'm also going to perform special tests to check the integrity of any ligaments that might be involved. And I'm also going to check if they have pain with passive motions of the ankle. As far as general treatment for a lateral ankle sprain, it's going to depend a little bit on the severity of the injury. A minor sprain can lead the patient to being fully recovered in 1 to 2 weeks with minimal involvement needed. A severe or full tear may take several months to fully heal. On the bright side, rarely is surgery indicated for this type of injury. Some things you might use are bracing, at least initially with more severe injuries, and that it can be helpful to prevent further aggravation. Some people like to use athletic tape and taping. It's been shown to have limited effectiveness, but I like to tell my patients, if you think it helps, it's not going to hurt anything, so keep on using it. As the pain and swelling decrease, then we like to introduce isometric and various other exercises if we progress to whatever the prior level of function of the patient is. So if it's a basketball player, eventually we're going to be involving high level activities including jumping and plyometrics and very dynamic activities to really make sure that this athlete or patient is ready to return to the field. Well, I hope you learned something today. Remember, if you believe you suffered an injury, what you learned here today is not a substitute for a thorough evaluation through your healthcare professional in person.